Hi everyone, you're listening to the Health and Wellbeing podcast. I'm Alison Mitchell, a practicing naturopath, and you can find me on naturopathnSW.com.au. These podcasts will feature discussions on various health conditions, health tips, and nutrition from a naturopathic perspective. Sometimes it's just me, sometimes I'm interviewing guests. All the time, I hope to share with you information on health and wellbeing with the aim to empower and educate. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. Hi everyone, thanks for joining us. So you're listening to part one of Adrenal Fatigue. I'm joined with Lisa Costa Bir, a fellow naturopath, and hopefully we can shed some light on what is adrenal fatigue and what does it cause and how you feel when you have it and what's actually happening in the body. So I know that, Lisa, you do quite a lot of work with adrenal fatigue in your clinic, don't you?
I do. I pretty much test every single patient that comes into my clinic for adrenal fatigue.
Yeah, right. So it's pretty common thing that you're seeing.
Very, very common, particularly as I specialise in the management of thyroid disorders, and the two tend to go hand in hand.
Yeah, definitely. Oh, we'll be interested to sort of talk about how that actually happens as well. So what actually is adrenal fatigue?
So the adrenal fatigue is a state where the body, there are three different stages basically, but the adrenal glands, I'll give you a little introduction about the adrenal glands first of all. They're two pyramid structures that sit on the back of each kidney. And what they do is they secrete different hormones. So over 50 different types of hormones that have a really big job to do. But the most important ones that we're interested in are cortisol, which is our stress hormone, and adrenaline, noradrenaline, as well as small amounts of estrogen, progesterone, and testosterone. So in adrenal fatigue, there are three different stages. There's a stage one, which is our I guess you could say it's more of a fight or flight response. So usually very, very high levels of cortisol, which is our stress hormone. But by the time you get to stage 3 adrenal fatigue, which takes a little while to get there, your body's actually not producing much cortisol. It just can't meet the demands that are required, and DHEA is also low. So these people tend to feel very flat, very, very fatigued, whereas stage 1, though they may feel fatigued, because they've got so much cortisol being secreted, they tend to feel really irritable and anxious, and sleeping may also be an issue because those cortisol levels are keeping them wide awake, really. So I tend to call that the wired yet tired stage, whereas stage 3, it's really hard to get going. It's hard to get out of bed in the morning for most people, and those people tend to really love coffee and sugar because it gives them a little spike. Coffee actually spikes our cortisol levels and makes us feel temporarily better. Adrenal fatigue is just a stage where the body is either producing excessive cortisol or not producing enough, and it's really a state of depletion.
So it's not so much as the name actually suggests that adrenal fatigue is where our adrenal glands are literally fatigued. There's just like this whole other sort of system of things happening, but that's the usual patterns that you would be able to sort of place people in.
Yeah, exactly. And then what we see is with adrenal fatigue, it can lead to chronic fatigue ultimately if it's not sorted out, because their cortisol levels become so low that the person is just really tired all the time, and then all sorts of other things go wrong too. The immune system starts to malfunction. Every single system in the body is affected.
Yeah, because there's so much that can cause chronic fatigue syndrome, and definitely like when you've got that stress and that cortisol and the HPA axis dysfunction happening, that can be a huge player as well.
That's right.
So you can go between those different phases of the stress as well, can't you? So you can sort of flick in and out of stage 1, and that's a fairly normal stage for people to be in. That's just like everyday life. And then stage 2 and stage 3 is when you start feeling it on a more long-term basis.
That's right, exactly. So stage 1 is really a warning sign by your body saying to you, look, this isn't right. The way that you're living your life, the amount of stress that you're under is not sustainable for me. And most people tend to just keep going and not really changing those habits. And then ultimately, on a long-term basis, that leads to stage 3, particularly if you throw in some major stresses like a divorce or an unhappy relationship or having a child or a stressful job. There needs to be some sort of usually multiple initiating stresses in there to really lead to adrenal fatigue.
So stress, in terms of what can actually set adrenal fatigue off, stress is a huge thing.
Absolutely.
And
exactly.
like you said, we're saying it's like emotional stress can be a huge thing, and that's all that stuff that can happen. And
but there's also dietary stress and inflammatory stress. So often, people don't think about dietary stress as being a cause of stress in the body. So skipping meals and leaving big gaps and your blood sugar dropping, well, that's a stressor to the body as well. Or too many stimulants, that's a stressor to the body. So, or even not getting enough nutrients, that's a stressor to the body. And then you've also got your inflammatory stress. So any inflammation in the body, and most people, a lot of people that we see suffer from period pain on a monthly basis, or migraines or back pain, and they kind of just don't tend to think of this as being a stressor to their body. But these are all forms of stress, and often people have more than one of these going on at the same time. So they may have emotional stress, they may have inflammatory stress, and they may have dietary stress all combined, and your body is just thinking stress, stress, stress on a daily basis, and often all throughout the day. So your poor little adrenal glands are secreting cortisol all the time, and they're not really meant to, because cortisol is only meant to be secreted on a small amount where there's a major stressor. So if we take it back thousands of years ago to when we were hunters and gatherers, and we were out there with our pitchfork or with our stick or whatever, and we were looking for our berries and our nuts and our seeds, and we come face to face with a lion or tiger, we're faced with a perceived stressor, something that could kill us. So our cortisol levels are going to shoot through the roof to alert us that there's a danger. And that's a good thing, because we don't just want to be sitting around relaxed and, there's a tiger, fantastic, because it'll kill us. So the cortisol makes us think, okay, what am I going to do? Am I going to run away and hide in my cave, or am I going to kill it? Being animal lovers, we're going to run away, hide in our cave. When the perceived stress is gone, our cortisol eventually comes down. But in the world that we're living in now, most of us are stressed all the time because we're thinking, I'm late for work. Quick, got to run, got to swig a coffee down while driving simultaneously and putting on my makeup at the same time. And then, finger up in the air because that person's trying to cut me off, and, there's stress all the time. So there's plans up, drive, and they really should be.
And like deadlines and then like fighting with people, like maybe fighting with your spouse or fighting with people at work and all of that sort of stuff, or your in-laws, common source of stress for my patients. I always hear about that. Yeah.
And then certain periods of the year, Christmas for a lot of people is a really stressful time, even though it's meant to be a time of joy and, family and all the rest of it. A lot of people, as you said, don't like spending time with their family. So certain times of the year can be quite stressful too.
Yeah, I think that Christmas is fun when you're a kid, and then when you're an adult, then you've got too much responsibility involved around that time. But it's interesting what you were saying as well about the inflammation causing a form of stress as well. So having an injury or a chronic injury can certainly have a player as well. But similarly, having adrenal stress as well will mean that you're unable to heal from your injuries as effectively as well. So that's sort of a catch-22 there.
That's right. Yeah. And often people find that they can't shake off certain diseases. So I'm seeing a lot of people who have parasitic infection at the moment, say Blastocystis or something like that. And the conventional treatment is usually antibiotic therapy, sometimes, multiple rounds, but they're not able to actually kick off and get rid of that parasite because they're actually in a stage of adrenal fatigue. And it's very common for people who are in that stage 3 adrenal fatigue, because they're so depleted, to not be able to get rid of bugs and, H. pylori bacteria, another example, where if you're really, really depleted and you're adrenally fatigued, that's probably not going to happen. So often, we might like to do 6 months of just getting the body back to where it needs to be, using adrenal trophic restorative herbs, improving their diet, lifestyle, all the things that actually impact on adrenal function. and then their body hopefully can kick off that bacteria or parasite itself, or at least if they decide to do the herbal medicine or the antibiotic therapy, they stand a much better chance of actually getting rid of the parasite because their body's in much better shape.
Yeah, that's a really good point. I have that same sort of approach as well. Like, you've got to have that back end, front end therapy where you're treating the gut and you're treating the nervous system at the same time. Otherwise, it's just like it's just going to be pushing back on each other. Yeah. And another thing that can often happen as well is that like periods of stress around the time that the adrenal glands are starting to develop, that can actually set you up to be more prone to stress later on. So adrenarche, which is like when your adrenal glands are starting to develop, which is usually a couple of years before puberty starts. That's usually around maybe like any time from 8 or so. And yeah, if you have any major stresses in your life at that time, then that can set you up to be more prone to a bit of adrenal fatigue.
That's really interesting. So, for example, I guess kids whose parents are getting divorced or are not having a good time at school and so on, that would play a major role.
Yeah, or like developing chronic fatigue, glandular fever at that time. That can sort of be a harder point because their adrenals are just starting to kickstart. If they get sick at that time, then that can really set them up for some issues.
Interesting.
Yeah, I do a bit of work with children and teenagers, and a lot of the time it is never been right since that sort of time. And that's usually what's happening. Maybe even just like they weren't getting the right nutrients that they needed.
Yeah, that's what I was thinking. Yeah,
adrenal development. Of course, that's just theoretical, but
makes sense. You know, you are what you eat, and you need all those nutrients for your body to function well.
Yeah. So I think for a lot of people, they find that adrenal fatigue is kind of almost like a made-up condition. And so I think what I wanted to sort of really dispel in this talk today is that it's not. But for me, what I find the issue is that adrenal fatigue is a term that a lot of naturopaths use, but it's not just it's not just that cortisol being depleted that's actually happening. It's that HPA axis dysfunction, which is the hypothalamus, the pituitary, and the adrenal glands. And so this HPA axis, there's a lot of different axes in the body. You've got your HPA adrenals, HPT thyroid, HPO,
ovarian,
yeah. So all of these things, when the signaling isn't right, that's when things start to really go a bit wonky. But the hypothalamus and the pituitary have a role to play in this whole complete picture that's happening. So one of the things as well is that when people who are really highly stressed, the hypothalamus produces this corticotropin releasing hormone, which then sends a message to the adrenal glands to do their thing. And so this is why a lot of people are feeling stress. It's not just starting at the adrenal glands, it's starting higher up.
Absolutely.
And one of the things that's happening as well is there's a neurotransmitter called orexin, which is being produced by the hypothalamus. And when you're chronically stressed or when you've got inflammation from whatever cause, which is usually things like being overweight or eating something that's not right for you, then the orexin neurotransmitter is actually going to be suppressed. And so then that's why people get real fatigue associated with adrenal fatigue. So orexin is actually what the autoimmune cells target in people with narcolepsy. So that's why they get that falling asleep all the time. So inflammation has a huge role to play with it, as we were just talking about before. And so I think that basically why I'm saying this for is that for people who are like, oh, adrenal fatigue, pish posh. It's like, no, it's the thing. It's just that it's at this stage. So this is the plane going over. At this stage, it is pretty complicated. And so the job of a naturopath is to actually, or a nutritionist or like a healthcare practitioner, is to be able to say, all right, well, I think this is actually what's happening for you. But definitely I think we need to be addressing inflammation as all of these things as well.
Absolutely. Yeah, absolutely. So in terms of testing, like what I find, you can't deny that there is a condition called adrenal fatigue because you can test for it. And we use, functional medicine testing. I usually suggest doing a saliva profile, which is called an adrenal cortex stress profile. So the company I use, a health scope, but there are a range of different testing facilities that can be used. And basically they're doing four saliva samples throughout the day. And that's just to get a nice map of your circadian rhythm, basically, because your cortisol should be highest in the morning, about half an hour after you wake up. So ideally that's when you would do your first sample. And then it should drop throughout the day like this. So that, around 8 o'clock, 9 o'clock, it should be at its lowest point. But what we see with stage 1 is that their cortisol may be like through the roof, much higher than it should be. Stage 3, much lower. And then you get all sorts of strange things too, where cortisol might be high at 8 o'clock, but low in the morning. So if it's high at 8 o'clock at night, that person's going to find it really difficult to be winding down. They often have overactive minds and they're ruminating, thinking about all the things they've got to do. And, they get a peak at 10 o'clock. And instead of going to sleep, they're out there. I find this with a lot of my mums. They start ironing or cleaning or something like that. And obviously that's not great. If you're not sleeping, then you're not getting that rest and rejuvenation to actually heal. So I find that doing the adrenal stress profile is a really good way for clients to see exactly what's going on with their cortisol levels throughout the day, because we can guess, but I'm not always right. I'm usually right, but I've done so many of them now, I can usually pick it. But often there'll be little differences with each individual patient. So I think it's a really great thing to be able to test, and each person can see exactly what's going on with their cortisol levels. And, it's really good for patients, because sometimes they'll say, I'm so tired, so fatigued, I just can't get myself going. But, my blood tests show everything's okay. When we do the adrenal cortex stress profile, we can say, well, of course you're feeling tired and fatigued. It's not to do with your iron or anything like that. It's just due to the fact that you've had so much stress in your life that you're completely depleted and you're not producing enough cortisol throughout the day. Once we get working on that and using different herbs and supplements and lifestyle techniques to support that, they feel so much better. You can do a saliva blood test to look at your morning cortisol. The GPs will do that. But unfortunately, it's not the most accurate reading, because when you have a needle, automatically for a lot of people, that's an invasive procedure. It's a bit stressful. So your cortisol will actually be increased. So you're only getting that one reading in the morning. And, some people's morning cortisol is fine. It's just all the stuff that's happening the rest of the day that's not so good. So one reading isn't particularly useful unless it's really high. Getting a nice map of what's happening in the whole day, how you're managing your stress throughout the whole day, is a much better, indicator of what's going on in your life. And with the saliva one, they also look at your DHEA as well. And that's also a very important hormone in terms of how people are feeling with regards to their vitality and libido and so on.
And their repair.
Absolutely, yeah.
I think that one of the benefits with doing the saliva test as well is that you can actually target the treatment. So that, if you're particularly high at one point, then you can go in with things that will lower the cortisol and vice versa. And with the DHEA as well, that's also involved with the inflammation and the wound repair and the not being able to recover from illnesses as well.
Yeah, I love that you said that, because I find it really frustrating when practitioners just diagnose, you're adrenally fatigued, but they haven't done a saliva profile, because it's quite an intricate little system. People aren't just all low throughout the day. Sometimes they have highs at 8 p.m. and you want to lower that. So you need to be able to target your herbs specifically, and you can't just give. We know licorice is a really good adrenal tonic, but you can't give licorice at 8 p.m. because it extends the half-life of cortisol, and you're going to make their cortisol even higher, essentially. So just giving, products that contain licorice as just blanketing and going, you've got adrenal fatigue, take this product. There's not a lot of, it's lacking in terms of knowledge to do that.
Yeah.
It's pretty reductionist.
I think I feel the same way, because I do find that adrenal fatigue is much more of a complicated issue. So you do have to actually sort of target it according to what's happening for the individual, which is what we do.
Yeah.
Yeah. So what are some of the symptoms of adrenal fatigue that are pretty common, and then what are some of the rarer symptoms that people would get?
So it depends on what stage of adrenal fatigue they have. I usually find the stage ones tend to be really irritable. They can be very, very anxious due to those high levels of cortisol because the body's in that sympathetic nervous state and it thinks it's prized for attack. It's thinking, oh, there's a lion. So anxiety tends to be high. Insomnia may be an issue, panic attacks even, and just being very jumpy. So a car may backfire and they will have an exaggerated response to that stress. But then in that stage 3, because they're so depleted, a car could be there or essentially that lion could be there to attack them, and they're just so fatigued and depleted that they're like, oh, just come and get me, lion, just carry me away. I can't mount a response anymore. I'm too depleted to really do that. Fatigue, depression, all those types of symptoms really fit in low blood pressure with the stage 3. But that doesn't mean, a lot of people think, oh, if I'm a stage 3, I wouldn't be able to get myself out of bed. It's in line with chronic fatigue, but that's not true. A lot of people who have stage 3 adrenal fatigue are highly functioning. They have just learnt to, even though they're tired, they still just drag themselves out of bed and maybe drink a coffee or 2 or 8 or 10. As I met with one person yesterday, 10 coffees a day, suffering from anxiety. But that's just become their normal. They have learnt to function in that way.
Yeah, okay. So some of the rarer symptoms as well that people might get, that can be related to cortisol, that can be related to all the inflammation that's happening as well, but that can be things like feeling cold all the time and poor circulation.
Night sweats
Yeah,
too.
yeah.
Yeah.
And I think that blood sugar level disturbances are a huge part of adrenal fatigue. But actually, having said that, I think that sometimes blood sugar level problems can come first. And so if you're eating poorly, so maybe you're not eating enough, maybe you're eating too much, maybe you're eating too much refined foods, that would be the first thing that I would personally suggest that people start looking at, because I find that if you can control your blood sugar levels, then your cortisol isn't going to be mounting a response to a low blood sugar level response as well. So eating regularly and well is the first thing that I usually get people to do before I even go in with cortisol testing or adrenal herbs. And usually it only takes a couple of weeks to actually notice a difference from doing that, if that's all it is. Whereas if it is much more of a chronic sort of condition, then that's when I would go in and say, okay, I think it's warranted now that we do a test or we use some herbs, etc.
Yeah.
So are there any other tests that you recommend for people with adrenal fatigue apart from the cortisol saliva test?
I like to do all the hormones as well, because what I find is in adrenal fatigue, if there's something called the pregnenolone steal that happens. Pregnenolone is a molecule that is required to make both cortisol and progesterone. And when people are chronically stressed all the time, the body is pushing that pregnenolone down the cortisol pathway, and as a result, progesterone becomes low because none of the pregnenolone is going down that pathway. So then they can start to suffer from a lot of menstrual disturbances and a lot of the signs and symptoms associated with low progesterone, such as irritability and teariness before the period. They may start to get insomnia just before they get their period. And as a result of that low progesterone, automatically they become estrogen excess. Even if they don't have a lot of estrogen, automatically it throws the hormones out in that way. So some people will have really light periods. Other people will get very, very heavy periods with lots of clotting and pain and so on. So I like to do a full hormone profile as well, just to see what's going on there. But ultimately, you still need to just work on supporting those adrenals so that they start doing their job properly, because particularly something I see a lot with perimenopausal women is that they've been under stress for a long period of time. And then when it comes to perimenopause, what happens is the ovaries and so on, their function is declining and they're not producing the hormones anymore, such as estrogen. It's actually the adrenals' job to kick in and be supporting the body and producing that estrogen and progesterone and testosterone and so on. But if they've been chronically depleted, well, they're not going to be doing that. And that's when women get much more pronounced symptoms, because the organs that were meant to be supporting the body have been so fatigued that they're not doing that. They're not producing those hormones. So again, even with perimenopausal women, I'm supporting their adrenals rather than just giving hormone supporting herbs, because it's the adrenals' job to be doing that. We need to fix them up. Otherwise, they'll be on hormone therapy forever.
Yeah, it's not actually fixing the problem, just sort of putting it in there. And so in terms of the labs, do you just use the health scope for the baseline hormone profile as well?
That's right, yeah. But or I'll just do regular old blood with GP.
Because I know that Naturopath is another lab that does a few different types of hormones as well, and they're including a bit more of a diverse amount of hormones. That's only just something that I've learnt about in the last year.
What's exciting about the labs as opposed to conventional medical tests is they test the different types of estrogen. So at certain times in the life cycle, you know, the 3 different types of estrogen are higher or greater, and they show the more proliferative types of estrogen that are associated with breast cancer and so on, you know, if they're out of range. So I think that can be a really interesting thing to look at for women who have a history of estrogen-dependent cancers in their family and things like that, and just target that a bit more if required.
Yeah, definitely. And you might need to look at the liver and that sort of thing as well to help with all that's happening. And then the other thing is the thyroid function, as you were talking about earlier.
Yeah,
so,
yeah, definitely.
Yeah, so which you can do with blood tests. You can get a lot of symptoms just from talking to someone. Like you can get an understanding of what's happening there. Even doing something like your temperatures in the morning is a good way to gauge how both your thyroid and your adrenal function is going. Because if that's chronically low, then that means that they're both struggling.
That's right. Yeah.
Awesome. So I've spoken a bit about how inflammation is involved in this HPA axis dysfunction before, but I just want to go into it a little bit further just so people have got a bit more of an understanding. So what's actually happening is that this inflammation is causing the HPA axis to cause an elevation of our cytokines, which is a type of immune cell. So in particular, what we can test for this, and what you might see is something called tumor necrosis factor alpha, or TNF alpha, and another one is interleukin 1b. And so what happens is that these being high, they then go on to affect our neurotransmitter balance, and the main way that it does that is what we were talking about before, is that sleepy neurotransmitter orexin. So what is actually causing us to become inflamed? Well, a lot of the time it's coming from our diet, and this can be from maybe eating too many foods that disagree with us, or like you might even benefit from doing something like an elimination and challenge diet, which can help you to identify if there's any sort of food intolerances. So the most common ones are wheat, dairy, eggs, soy, peanuts, and citrus. I usually get people to start with looking at the wheat and the dairy and the eggs first, and then go on from there, because the consumption of the other ones tends to be a little bit lower. And the other thing is that it can be coming from fatty acid imbalance. So a lot of the time people are having too much omega-6 in relation to their omega-3, and this is because we're having a lot more grains in our diet, and also because our the meats that we're eating are fed on a grain diet, whereas if they're fed as close as they should be to nature, such as like for cows that's grass, and for chickens that's grass and grubs, then they have higher omega-3 in their tissues, which then we get the benefit from when we have. And it can also be coming from too low levels of good bacteria in the gut, or too high levels of bad bacteria. So as you were talking about before, like with the people with the chronic infections like the Blastocystis, that sort of thing. And also the immune system can go wonky as well. So like that could be if maybe you're not fighting off an infection properly, maybe you're nutritionally deficient in like vitamin C or zinc or vitamin D or iron, or it can be an autoimmune problem. And so any sort of chronic infection that you have, like that might be sometimes like dwelling around there, that might not actually be giving you any sort of obvious signs that you have an infection. So you can do a few blood tests, like you can look at your white blood cells in particular, like your monocytes, to see if there's a bit of a chronic infection. You can look for inflammatory markers in your blood tests as well. But a lot of the time, like you can tell by symptoms. So if you're generally achy, if you're feeling a bit lousy, if you've got maybe like a piercing that doesn't seem to heal, or if you respond to like when you put an earring in and you're really reactive to it, that's a common thing that I see, that people have got this not so great immune system, or if they're getting sick all the time as well. It can even be like a chronic runny nose, or like a bit of a sniffle, or like a chronic toenail infection, like just even something like that, which just does not seem all that obvious. That can be enough. Oh, and sleep. Sleep issues are a really common issue as well. So yeah, that's my rant on inflammation.
I know you're big on inflammation.
Yeah.
Yeah.
And I think, that's definitely something I wanted to sort of just, cover, because I think that it's an important player in what's happening with these people. So, all right, so next time we'll go into what we can actually do for adrenal fatigue.
Yeah, and there's lots we can do. It's very exciting. Yeah.
So that'll be good. So stay tuned for that. That'll be up next week. And what are you up to for the rest of the day?
I've got a lovely day in clinic, seeing patients.
Well, I'm going to go visit my nana, and then I'm going to clinic.
Lovely.
Yeah.
Nice
So
talent.
thanks for joining us, and thanks everyone for listening. So if you want to get in contact with me, you can find me on naturopathnSW.com.au. And if they want to get in contact with Lisa, it's Lisa Costa Bir, naturopath.com.au.
Great.
All right, thanks everyone. Bye.
Bye.